Good afternoon, everyone. Good afternoon, everyone. The reason why I'm doing this video is it's been requested. Um, so, uh, I have been sick for the past couple of months, so I wanted to give you guys an update um, on how things are going. So, if you didn't watch my last YouTube video, um, so I went to the hospital because I had something called cellulitis. And basically, I want to explain that to you guys. So the story goes is that the Friday before I went into the hospital, I had swollen legs from my lymphedema, like the usuals. And then Saturday felt poorly, didn't think anything of it. But Sunday, I uh, felt a little bit more poorly. So basically, I tried taking a shower, taking my medications, thinking that would help, not knowing what was going on. I was shaking uncontrollably. My husband took one look at me and says, "You're going to the hospital because you don't look good." Because my face was red, my lips were real white, and I spiked a fever, and so I went to the hospital, and they said that my vitals weren't good. My vitals were all over the place because I did take my vitals at home. So um my blood pressure was low, my oxygen was low. I had a fever of 104, which you know wasn't that great. So when they did testing on me, these said that I had like a blood infection and a bacterial infection, which is so basically what cellulitis is a common deep bacterial skin infection caused by and it causes redness, swollen, painful, and warm skin that can spread quickly. Often can start from a breakdown in the skin, from a cut, wound, so cuts, wounds, bug bites, even a rash if you don't take care of it. If there's um, let's say you have a cut on your leg or on your foot, and if you don't take care of it right away, an infection can get in there, basically. So, so, and also you can get fever, chills, fatigue. Um, your skin can change color, mostly. Um, you can get like a shiny, like skin on your pigment on your skin. Um, Left untreated would be bad. Basically, this is like a life-threatening uh, infection. Basically, It can affect your arms, legs, face, anywhere basically on your body. Um, so the cause and risk factors are most often for strep is basically cuts, burns, surgical wounds, insect or chronic skin tissue, and I don't know, I can't really lymphedema. There's all kinds of risk factors anyway. There's like, I'm not gonna name them all off, but those like cuts, burns, whatever. I'm sorry. I don't mean to repeat myself, but those are mostly like how you can get the infection. Um, surgical so the other risk factors are like if your immune system, diabetes, obesity, chronic swelling, lymphedema, injection drugs use, and contact sports. Basically, I think like anywhere, basically, if you have any contact, like basically any injuries, really. Um, so treatments and preventions for those are like going to see a doctor. The doctor will prescribe you antibiotics, either oral or IV. Um, basically, um, care from at home is elevating the elevating the limbs that have the lymphedema. Oh, not the lymphedema. I mean the cellulitis. If it's painful, pain relievers, uh, good hygiene, preventing skin from breaking, proper wound care, and managing underlying skin conditions. Basically, uh, trying to prevent that from happening. And of course, seeing the doctor. So I'm sorry, I am like getting these out of order, but basically, like I was saying, I did go to the hospital because of these conditions that I named off here. So when I went to the doctors or when I went to the hospital, I did have a skin infection. Plus, I did have a blood infection that um, wasn't good. Uh, I did have to stay at the hospital for IV antibiotics in order to get everything under control, basically. Um, I did also have to give a lot of blood just so they could keep an eye to see where the levels were. I did also have to get an IV in my neck. So what that is that when my blood pressure was low, they give you medication for your blood pressure, but you need to put it either in your neck or someplace that because where the medication was very high strong and it wouldn't go in the regular IV, so that's why they had to do it in that IV. They took me up to the ICU. I spent, I want to say, 4 days in the hospital. Um, After the fourth day, day 5, I went home. So that Thursday, I went home because they thought that things are going good. Then I went back to the hospital the following day because they didn't like how my leg was looking. So after I went back to the hospital, well, no, I went to the clinic first, the urgent care clinic, because I didn't like how my leg was looking. And so neither did my husband. So my caseworker came and brought me to the clinic. And when I saw the doctor there, they said that they wanted me to go back to the emergency room because what was happening with my leg wasn't good. It was very red and swollen still, and the wound on my leg was pretty big. So, but other than that, I did go back to the hospital. They kept me in the downstairs in the CDU to see how to monitor me. I stayed there overnight and then I went back. So instead of coming home like I wanted to, well, I didn't want to come home. Yeah, I did and I didn't. They sent me upstairs because my leg was doing very badly. They didn't understand why they sent me home in the first place. The doctor that saw me there. So I spent another, I want to say, almost a week in the hospital. And then they let me out finally with a PICC line so I could come home and finally come home. I could do my treatments at home. So that way I'm more comfortable because I really wasn't comfortable in the hospital. Plus, like, them keep coming in and doing blood work was a little irritating too. The only thing I don't like was blood work. They made me out the hospital food. Some of it was good, some of them wasn't good. But anyway, so they gave me a PICC line, sent me home. I did IV antibiotics at home for a couple of weeks. I think a couple of days, a couple of weeks. And then they took the PICC line out. Too soon, I feel. And then they put me on oral antibiotics, I believe. But those antibiotics I feel weren't strong enough. So they put me on. So when my nurse, Evelyn, came in, uh, she did not like the way my leg was looking. So she sent me back to the hospital. And I'm thinking, oh, great. Here we go again. I'm going to have to spend another couple of days in the hospital. Nope. I didn't have to. So they talked to somebody, a specialist in the hospital. And they put me on another oral antibiotic that was a little bit stronger than what I had. And that antibiotic seems to be working. I feel that that my leg's getting better. It's a lot. The wound is a lot smaller than what it was. My leg is almost back to normal color. Um, so, um, but yeah, that's my trip to the hospital. Sorry, this was a little jumbled up. I do plan on making another video to like kind of fix this one a little bit to explain a little bit about what's going on. Uh, so the past couple of months, I've been having our nurse comes in a couple times a week. Physical therapy, OT, occupational therapy. The OT stands for occupational therapy. That come in like maybe once or twice a week for now until I get better. I do have appointments coming up to, number one, get my toenails done so that I'm not cutting up the back of my feet. Two, I'm getting a what do you call it? A sleep study done. To get a new sleep mask. That was the other thing that hurt, was a little irregular. So I need to do another evaluation to get a better mask for myself. And then I do have, I am trying to get a referral for the lymphedema clinic to help with that. I do have to set up another appointment for my doctor's office so that I can see how everything is going. I have been doing some blood work a couple of times a week to see how the infection's going, and apparently everything has been going fine. It is a very slow progress, but I am slowly getting better. And things have been going good since I've been home. Like I said, I've been keeping up with my appointments. I haven't really done too much at home. As you can see, the boxes behind me, I still got to get rid of those. I am also basically doing some recovery at home. Like I said, I mentioned the therapies and the nurse are coming in. I've been doing my vitals at home, and my routine has changed a little bit since I've been home. Since I needed to change it because I am still walking with either a walker or cane because my balance has still been a little off. So, but other than that, I am doing better. I have taken a break on a few things because I am struggling with a lot right now as far as my recovery goes, and I want to be able to do some things, or I want to be back to normal, but it's got to take a while. So basically, like right now, I'm just kind of taking a break for some things, like some of the YouTube videos I'm taking a break from, but I'm still doing some videos, so we're good. I am taking a break from trying to get my business up and running because I need to focus on my health first. Um, I am working on some other stuff, but I am taking my time, especially with physical therapy because I do get tired real easily. So uh, I think this is all we're gonna do for now. I will do a second video to talk about the other half, but right now I need to rest. My leg is hurting, but I will keep you guys posted, and I'll see you guys in the next one. Bye.